Hello, my name is Lindsay Moore, and today I will be presenting my proposal titled The Relationship Between Nurse Communication, Satisfaction, and Patient Safety Culture. This presentation summarizes my literature review, the research gap, and the methodology for my proposed study. Nurse workload, staffing levels, and communication quality significantly shape patient outcomes. When these conditions are poor, patient safety is compromised. The issue is important because patient harm such as medication errors, missed care, delays in treatment, and extended recovery times often occurs not because nurses lack the skill, but because the systems surrounding them fail to support safe care. Research consistently shows that high workload increases interruptions, which raises the likelihood of mistakes. Poor staffing limits time for assessment and monitoring, delaying recognition of complications, and low communication satisfaction weakens teamwork and error reporting, which prevents safety problems from being corrected. These patterns make it clear that patient safety is not just an individual responsibility. It's a systems problem. When nurses lack clear communication channels, supportive supervisors, or adequate staffing, the entire safety environment of the hospital is weakened. So why does this gap need to be addressed? Even though we know that staffing, workload, and communication influence safety, we still don't know how nurse communication satisfaction specifically contributes to perceptions of patient safety culture. Whether communication satisfaction can buffer the negative effects of a high workload, or whether improving communication processes could meaningfully strengthen safety culture. This gap matters because without understanding this relationship, hospitals cannot design effective interventions to improve safety. If the communication satisfaction turns out to be a strong predictor of safety culture, then investing in communication training, leadership development, and handoff processes and teamwork strategies could significantly reduce patient harm. A turning point occurred in 1999 with the Institute of Medicine's To Err is Human report, which revealed that up to 98,000 deaths every year stem from preventable medical errors. Many of these errors were related to communication breakdowns and flawed system processes. This report shifted healthcare from blaming individuals to improving entire systems and emphasized the importance of patient safety culture. Although healthcare organizations recognize communication and staffing as safety factors, preventable safety events continue to occur. While communication satisfaction is known to improve teamwork and willingness to report errors, the degree to which it influences overall patient safety culture is still unclear. This gap limits the hospital's ability to design effective interventions. The purpose of this study is to examine the relationship between nurse communication satisfaction and patient safety culture. My research question asks, what is the relationship between nurse communication satisfaction and patient safety culture in acute care hospitals? Understanding this connection can guide hospitals in strengthening communication-based interventions. To support my argument, I drew from several peer-reviewed studies that examine how staffing, workload, and communication influence patient safety. One of those sources, with the author being Khanna and colleagues, found that higher patient-to-nurse ratios increase length of stay, which means slower recovery. Another source that I used, the author being Moriwaki and colleagues, showed that heavy daytime workloads and frequent interruptions increase medication error risk. Additionally, I used a source with the author being Max Hound and colleagues, explain why this happens, showing that high workload leads to rationing of care and emotional exhaustion, which lowers quality and safety. I also used studies on communication that found that higher communication satisfaction improves patient safety culture. Communication directly influences safety culture. A source that I use with the author being Navalyante found a significant positive correlation between nurse communication satisfaction and safety culture. Additional source that I used with the author being Nasiri and colleagues showed that structured handover checklists improve communication clarity and reduce omitted information. Additionally, it emphasized that interprofessional communication between nurses, pharmacists, and lab staff reduces medication errors. This strengthens overall care coordination. Together, these studies show the power of communication in promoting safety. When we integrate the findings, we see that communication staffing, workload, and safety are deeply interconnected. Even in stressful environments, strong communication can help teams catch errors, coordinate tasks, and maintain patient safety. Conversely, poor communication can undermine teamwork even when staffing is adequate. This highlights a major research gap. The field still needs a clearer understanding of how strongly communication satisfaction predicts perceptions of patient safety culture. To address this gap, the proposed study uses a quantitative correlational design. I plan to survey 150 to 200 registered nurses working in acute care settings using an anonymous Qualtrics survey. The communication satisfaction questionnaire will measure satisfaction levels, and the AHRQ patient safety culture survey will measure perceptions of safety. This design allows us to determine whether the two variables are significantly related. In conclusion, staffing, workload, and communication satisfaction and patient safety culture are closely connected. Strong communication practices can improve teamwork, support error reporting, and strengthen safety culture. Understanding this relationship is essential for designing interventions that support nurses and protect patients. Thank you for listening, and all of my references are included in my paper.